Thank you, Dr. Maloney. Hello, my name is Courtney Enos, and welcome to my scholarly project presentation. My research advisor is Dr. Maloney, and the title of my project is an investigation into the implications of depression and/or anxiety on aspects of college life. Mental illness is a pervasive health concern both nationally and globally as prevalence and incidence rates of mental illness continue to climb. Anxiety and depression are the most common psychiatric disorders both nationwide and worldwide. Anxiety disorders affect roughly 19% of the adult population each year in the U.S., while depression affects roughly 7%. In addition to high prevalence rates of anxiety and depression, there are significant functional impacts that accompany these disorders as well. Depression is the leading cause of disability worldwide and is the leading cause of disability in the U.S. for individuals 15 to 44 years old. Anxiety has also been shown to significantly impact functioning. Recent survey data from the Center for Behavioral Health Statistics and Quality found that 23% of surveyed adults with an anxiety disorder reported severe impairment. The same study found that 64% of surveyed adults with depression reported severe impairment. Another factor influencing the disabling characteristics of these disorders is their high rate of comorbidity with other disorders. Mental illnesses, especially mood disorders such as depression, are known to be comorbid with a number of medical conditions, including cardiac disease, cancer, diabetes, chronic pain, and others. In addition to being comorbid with other medical conditions, mental illnesses are also comorbid with other psychiatric conditions. For example, depression and anxiety have high rates of co-occurrence. The comorbidities associated with these disorders further contributes to the degree of disability associated with mental illness. College students consistently demonstrate high prevalence rates of mental health disorders, especially anxiety and depression. It is estimated that the prevalence of these disorders among college students actually surpasses that of the general population. Survey data from the American College Health Association found that 24% of college students surveyed had an anxiety disorder, 20% had depression, and 17% had both. College students are a high-risk population when it comes to mental health disorders, and there are several factors which contribute to their increased risk. First, the onset of mental health disorders is most common between the ages of 18 and 24 years old, which comprises early to late college and postgraduate years. Furthermore, depression onset specifically is most common in the mid-20s. Second, the severity of mental health issues tends to be greater among college students. Stress plays an important role in this factor as repetitive and overactive stress responses can contribute to the development of depression and anxiety. This is important to consider because there are multiple stressors that college students face, including academic, financial, and relational stressors. Coping abilities also contribute to the high risk of this population. Several studies have examined the relationship between severity of depression and anxiety and emotional regulation. A study by Mahmood and colleagues found higher levels of depression and anxiety in students with maladaptive coping strategies. Furthermore, maladaptive coping strategies were found to be an independent and significant predictor of depression. Research indicates that anxiety and depression can have serious academic impacts for college students. A longitudinal study done by Eisenberg, Goldberstein, and Hunt found depression to be a significant predictor of lower GPA and that depression increased the likelihood of dropping out of university. They also found that associations between depression and academic performance were strongest when depression co-occurred with anxiety, and this was found to be associated with a significantly lower GPA. According to the American College Health Association, 20% of college students reported that depression impacted their academic performance, and nearly 28% reported that anxiety impacted their academic performance. There are several social impacts of depression and anxiety among college students as well, including increased isolation and increased engagement in passive activities. However, research consistently demonstrates social participation as a protective factor against mental health disorders. Social participation is an important aspect of college life, and therefore this may greatly impact the individual's college experience. Finally, research also indicates several motivational impacts of depression and anxiety among college students. Research shows that individuals with depression and/or anxiety tend to exhibit avolition, anergia, anhedonia, and a reduced reward response, all of which impact participation level and motivation. A study of college students with depression done by Blanco and Barnett found that motivation and enjoyment were influenced by severity of depression, where only a mild state of depression was needed to significantly decrease students' motivation to participate in leisure activities and decrease enjoyment of leisure activities. In many ways, these disrupted areas of function relate directly to college student life and therefore can pose serious threats to overall success in college. The present study aimed to explore the lived reality of college students who had depression and/or anxiety, to further understand how the disorders affected their experience of college and impacted their ability to be a student, and to understand implications for occupational therapists and other clinicians in post-secondary settings. Participants of this study were full-time university students, 21 to 30 years old, who live independently from their parents or guardians and self-identify or have a formal diagnosis of anxiety and/or depression. Participants were excluded if they had a diagnosis of another severe mental health disorder. Participants were recruited through the use of flyers posted around campus. Interested participants contacted the student researcher directly via phone or email, and an initial screening for eligibility was completed. A qualitative research design using semi-structured interviews was utilized for this study in order to gain an in-depth understanding of students' beliefs, perceptions, and experiences. Interviews were conducted using a general format which included an introduction to myself as well as the purpose of the study, followed by completion of informed consent documents, a demographic questionnaire, and several self-report tools. Participants completed the Beck Anxiety Inventory, the Personal Health Questionnaire 2, and the Alcohol Use Disorder Identification Tool to gather more information about the participants. Participants were 4 students from a single Midwestern university. They ranged in age from 21 to 30 years old. 1 participant was male, 2 were female, and 1 identified as non-binary. 2 participants were undergraduate students, and 2 participants were graduates. Each interview was recorded and then transcribed verbatim into a Word document. Once fully transcribed, copies were provided to my research advisor as well as a student research assistant. Each researcher individually and thoroughly read and analyzed each transcript at least 3 times. After individual analyses were completed, all 3 researchers met via conference call to present and discuss significant findings. Findings were discussed at length until the researchers arrived at a consensus regarding pertinent themes. I then reanalyzed the transcripts to determine the final corresponding data points that fell within each of the identified themes. Following analysis of the transcripts, 8 major themes emerged. The themes include occupational imbalance, motivation, pressure to perform, social participation, experience of anxiety and depression, decreased health and wellness, academic consequences, and coping strategies. I will discuss several of these themes and provide quotations from the participants as support and demonstration of these themes. Findings revealed that participants had an overall lack of balance in their lives and struggled to manage their time. Participants described lack of balance among various areas of occupation related to college life and described how their anxiety or depression contributed to this imbalance. A majority of participants described feeling anxious and overwhelmed by academic work, causing them to refrain from engagement in other occupational areas. When reflecting on her lack of balance, one participant stated, "A lot of it too is feeling like I'm going to fall behind in school if I spend too much time with leisure activities or hobbies." Most participants felt academics consumed most of their time. However, one participant felt that time dedicated to academics was lacking as a result of depression. They stated, "I feel like I don't give school enough of my time because I often skip class or just don't do the homework." Time management emerged as a sub-theme within occupational imbalance. Several participants described impacts on their time management skills as a result of anxiety. One participant stated, "The anxiety tends to come from trying to keep the balance up." She went on to describe her habit of procrastination as a result of anxiety, stating, "The anxiety kind of makes me want to put schoolwork off further because I'm anxious about doing it." Another participant described how struggling to manage time exacerbated her anxiety. She said, "My weekends mostly consist of getting on track for teaching after I have been doing all of my own research and homework. So come Sunday night when I'm trying to prepare for all that, it's rough. I dread it." Participants shared their experiences regarding the impacts of depression and anxiety on their motivation related to their roles as students. One participant described, "I always used to be very good at sitting down and working on assignments. During my undergrad, I was great at that. And now I never want to. I still really value doing quality work, but I never want to." Another participant shared similar experiences when describing how her motivation as a student has been impacted, stating, "There are times when I don't want to do anything. I want to stay in bed all day and do nothing. I still have days where I'm like, I can't do it, I don't want to do it, I want to quit." Initiation arose as a subtheme of motivational impacts, with half the participants describing difficulty with task initiation as a result of their anxiety or depression. One participant said this in relation to depression. "Once I get started, I'll finish a paper, I'll do something, but I'd say getting the motivation, getting started is a big issue." Similarly, another participant commented on the challenges presented by anxiety, stating, "There's always this feeling that there's so much that I need to do, but I can't do it. Not that I'm not able to do it, but I can't start. I can't sit down and bring myself to do it." Analysis of interview responses revealed most of the participants felt a sense of increased pressure and/or anxiety in regard to their performance as a student. While discussing anxiety triggers, one participant described the pressures associated with the role of being a graduate student. "I want to impress my professors, so when I miss deadlines, when I am not able to participate in class because I haven't done a reading or something like that, it really bothers me. It's that feeling like they're going to be disappointed. That really makes me feel anxious and crummy." Another participant mentioned anxiety influences the way she views her ability to perform academically, resulting in inflated perceptions of failure. She said, "I just get into my own head about these things with school and pushing myself further. I just talk down to myself about school, so I think that gets in the way." All participants mentioned that depression and anxiety impacted their level of social participation. Isolation arose as an important subtheme. One participant described his experience as such. "When I'm depressed, I isolate a lot. I have a decent amount of friends that want to do stuff, but I usually find a way out of it, because I'm either anxious about what might happen or I'm depressed and I don't care." Another important subtheme that arose was impacts on relationships. Several participants alluded to strained, damaged, and/or lost relationships as a result of anxiety and/or depression. On the slide are several examples. All the participants highlighted the consequences their anxiety and/or depression had on their academic performance. Two of the participants revealed they had experienced significant academic consequences, including academic dismissal and failure to graduate on time. Participants also mentioned smaller day-to-day impacts on their academics, including participation in class and quality of work. One participant commented on his class participation, stating, "I don't always pay attention in class. If I'm depressed, I'll just be on my phone the whole hour. I mean, I'm there, but I'm not participating." The results of this study demonstrate the significant occupational disruptions among college students that can result from anxiety and depression. Findings from this study present the opportunity for occupational therapy involvement in post-secondary education settings. OTs can aid students in finding a healthy balance between school, work, leisure, and social engagement by evaluating and fostering organization and time management skills. Occupational therapy may also target role transitioning, adjustment, and performance by aiding in the development of college students' adult identity. In this way, occupational therapists may be able to foster a greater sense of purpose among college students, motivating them to engage in meaningful activities. There are several important limitations of this study to consider. First, transferability of findings is limited due to the small sample size. Second, participants of this study represent a convenient sample from a single Midwestern public university. Next, participants under 21 years of age were not eligible for this study. Therefore, a large subset of college students was missing from this study. Finally, all students who participated in this study were currently receiving some form of treatment for anxiety and/or depression. More research is needed to fully understand the impacts of mental health issues on college students' experiences and the implications they might have for clinicians working on college campuses. Further research might address a wider age range of college students or may look at a more specific portion of this population. It might also look specifically at the experiences of students at smaller, non-public, or liberal arts universities. Research looking at the impacts of other specific mental health disorders may also enhance knowledge. Further research is also needed regarding the role of occupational therapy in working with this population. These are my references. I would like to thank Dr. Maloney for her guidance and support through the development of this project. Thank you to my research partner, Whitney Neese, for assisting me with the analysis of the data. And thank you to the class of 2020. Thank you for listening, and I look forward to answering questions during the Collaborate Q&A session.